The Health Minister David Clark insists that the Pharmac drug funding model is the envy of other countries, even as an international expert says New Zealand is way behind on breast cancer treatment. Dr. Fatima Cardoso says patients in countries that fund new advanced cancer drugs live on average 5 more years compared to the New Zealand average of 13 months. Patients here with stage 4 cancer say they've been forgotten, and it's high time for an independent review into Pharmac. I asked David Clark how much his life is worth.
The question of how much a life is worth is not something I've prepared for this interview. I think it's fair to say that for most people their health is the most important thing in their life and the thing which they care most about and would like to see most invested in.
It's an important question though, isn't it, Minister? Because basically, in reality, the health system is making decisions every day based on cost-benefit ratios, so how much a life is worth.
That's right. Certainly for the parties of government, there was a really clear agreement that we wanted to put more money into the health system. The amount of money that was being spent on health as a proportion of our economy actually dropped under the last government, which is very rare in the Western world. And we did some independence analysis to try and work out how much, and we worked out that about 2.3 billion had been stripped out effectively over the 8 last years of the previous government, meaning that in order to get care you had to be sicker to reach the thresholds, and so that's why we put the biggest funding boost in that it had been put in for about 10 years in our first budget.
The thing is though, Minister, some drugs are still not being funded, drugs that would prolong life, and in this case of women with end-stage cancer. So when it comes to that, how important is prolonging life compared to saving it in terms of weighting our spend?
Well, these are the difficult decisions that the experts at Pharmac make, the clinical experts. They have used standard international measures which give us the comparisons with other countries that people often rely upon for their claims about whether we're spending enough or not. They have ways of measuring the quality of life for people and the number of years that they have, and they make calculations that aim to maximise the health benefit for New Zealand from the drug spend.
Yeah, but you set the tone, don't you? So where do you think the weight is? Is it 60-40 in favour of curing? Should 95% of the health dollars go on curing and only 5% on preserving life? Where do you sit on this issue philosophically?
Well, ultimately, I do think that that's a matter for the experts. We believe that people need to have
That's a cop-out, isn't it, Minister?
Lisa, if you let me finish, I do think it's a good question. I'm not trying to dismiss the question. I think it's a good question. Ultimately, though, I take advice on these things, and I do believe that we as a country need to spend more on quality. We spend a lot of money on prolonging life, surgeries often. There's lots of critique about the Western model of healthcare where we perform surgeries in the last years of life that stretch out life, but ultimately have a cost to the quality of life for people in their final years. These are difficult and sensitive decisions, but again, I really do think that they're best made by clinical experts.
Well, because it basically comes down, doesn't it? This conflict over funding new life-preserving drugs is pure and simple a rationing issue, isn't it?
No, it's not, unfortunately, quite as simple as that. The advice I receive is that many of the drugs that are coming out don't do what they say they're going to do, and one of the visiting cancer experts, indeed at the recent cancer conference, said that about 70% of these new drugs don't do what they say on the tin. That is the stuff that the clinical experts at Pharmac wade through. There are examples of drugs that have been funded in very short order, some of the new cancer drugs, when they've been shown to have really good evidence behind them, and the case probably best celebrated is the Opdivo, which was a melanoma drug funded in 2016 after just a few months after the application. So these are difficult decisions, and again, Truvada, New Zealand was one of the first countries in the world to fund that to prevent HIV infection. We did that last year. Where the evidence is there, Pharmac can move very quickly. Where the evidence is less clear, they're balancing up how many other treatments they could buy for other conditions.
But we're not 100% clear on what evidence Pharmac is using, because in response to our questions about why it's not funding some of these newer drugs, it says, and says repeatedly, that it is, as you have raised, a lack of evidence and only modest outcomes for these drugs. But a number of doctors working in this area say there is a lack of transparency around Pharmac's analysis, what evidence it's using, what measures it's using. Why don't you make them put all of that information out there so that we can see if these are solid decisions?
I think there's a tension that's being explored here by Pharmac. They do rely on the international experts, and you can find international experts agreeing broadly around which drugs are more effective and which ones are less effective. It's at the margins that these calls get disputed. Pharmac also is in commercial negotiation with these providers. That's how Pharmac manages to afford more drugs for the population than in other countries with the same budget. It is actually about making sure that there's a negotiation with these companies as well. Now that's part of the Pharmac model. It's not directly related to your question, but it is a factor.
Well, some people would dispute that it's just at the margins that there's disagreement about the effectiveness of these drugs. I mean, we had a recent cancer conference here where a leading oncologist said that we seem to be ignoring very decisive evidence about the effectiveness of some of these drugs. If it's good enough for the UK to fund some of these, Canada and Australia, why isn't it good enough for us?
Well, I'm certainly very interested in the new UK model, and I've relatively recently received advice again from the Ministry of Health on it. They still say it's too soon to evaluate it. The previous early cancer medicines fund that they had set up in the UK, when they evaluated it, they found that there would have been about 5 times as much value generated if the money had been left in the NHS to spend on a variety of drugs rather than put into the cancer fund. So that's why they've started again from scratch a couple of years ago. I'm very interested to see how that new model pans out, and we're expecting research and data to come out on that soon. We want to make sure, I think as a country we'll all agree, that we want to get the best value out of the drug spend that we have as a country, and Pharmac and the clinical experts look at the different models around the world to see how we can get the best value.
Well, best value is subjective, isn't it? Which is why I started by asking you what you think your life is worth, because when Pharmac talks about modest benefits, which might be 4 or 5 months of extra life, that could be an extra 25% living for someone who has got terminal cancer. So for them, it's worth it. So cost benefit is subjective, isn't it?
I would push back a little on that. Of course, for every individual, whatever life they can get is valuable to them. Let's acknowledge that. But those international comparators that are used around quality of life and life years generated by drugs are reasonably standardised. And so that is the kind of measurement that Pharmac will look at. It will look at the research and compare to other countries. It's also the same data that those people rely on that say we're not getting all the drugs that we might want that we see in use overseas. It's looking at how many life years are preserved by individual drugs and then looking at the mix. And overall, the truth is that most of those countries come and visit New Zealand to see how they can improve their systems by looking at the Pharmac model.
Let's revisit some of your election promises, ensuring all New Zealanders get the same standard of cancer care, no matter where they live. What about the same standard of care regardless of whether they've got a house to sell for treatment or whether they've got a good story that they can put on a Give a Little page to raise money for their treatment? What about equal care regardless of how much you're worth?
Well, this government is absolutely devoted to improving equity of outcomes. That is one of the big problems that's been identified. The best and most effective way of doing that is screening earlier, and the big disparities there are among Māori. There was some improvement under the last Labour government in terms of, under the last National government in terms of improving that equity in terms of screening, but there's still a long way to go, and we do need to see people, regardless of where they live, getting the same kinds of access to treatment, no matter which DHB they're in. And
what about
that's something that will be in the new
wealth,
Cancer
Minister?
Action Plan.
What about regardless of wealth? Because that's what I was asking about. Because we seem to have a two-tier system, some people would argue, when it comes to cancer care based on wealth. You can live longer if you've got a house to sell so that you can fund your own treatment and get new drugs. Or you raise some money. Is that what we should be doing, having fundraisers for cancer treatment?
as a government, we are wanting to see a stronger public health system that's really clear and really upfront. We do want to build the public health system. That is why we put more money into the public health system last year than has been put in for a decade. It's why you're likely to see generous health funding continue under this government. It is a priority for us to make sure that health services are more accessible to everyone rather than the situation that we've inherited.
Then why is it that people are fundraising and are on Give a Little for drugs that would prolong their lives?
Well, this is where we started out. I mean, we did look into this in opposition and saw that funding really hadn't kept up with the needs of the health system. And
it still isn't, some people would argue,
That's
Minister.
Right. I absolutely agree with you, Lisa. We unfortunately, we cannot address 9 years of funding in one budget, not even in two budgets. It will be a wee while till we catch up to where we ought to be as a country, but we're determined to get there.
Will you commit to an independent review of Pharmac's funding of new drugs?
At this stage, I'm not convinced that that's necessary. Certainly, the advice I have is
why not?
From
given
people
the
in
huge
New Zealand
public
and
debate,
overseas.
Given the huge public debate, I'm sorry to interrupt, Minister, but given the huge public debate, why not set it to rest with an independent review of how they are doing funding new drugs?
At the moment, the advice that I receive both in New Zealand and from visitors overseas is that Pharmac is delivering better value than other health systems around the world. We've got a review for
so you'll take the word
health
of
and
visitors from overseas?
And from New Zealand, as I said, and from New Zealand, from the advice that I receive internally as well, is that we currently have a system that delivers the best value of any like country around the world. What we've got at the moment underway is a review of the health and disability sector. We have great ambition to invest more money in health, and we need to deal with things one at a time.
And that was Health Minister David Clark.